All across our nation, healthcare organizations and hospitals are constantly striving to offer exemplary care and perfect the patient experience. Experts say embedding a lean culture that promotes and sustains continuous improvement in the quality and timely delivery of products and services is paramount.
A lean culture is really putting the patient first, and all decision-making is related to what's right for the patients. But we need our frontline care teams to really deliver on that by continuous improvement and the skills and competencies around that. In healthcare, as with many industries, there's a phrase that says culture eats strategy, and that we throw up our hands and say we can't really manage culture. Oh, we can't change culture. That's just who we are. We've learned that through deliberate behaviors and change in our executives that we can really shape culture in a different way. And so we want to be explicit and deliberate about our behaviors that promote the kind of culture that we see as important for healthcare.
In response to a growing demand from healthcare organizations worldwide to apply lean management methods, the Virginia Mason Institute was established in 2008 to be the primary resource and inspiration for those who seek to transform healthcare. Believing a lean journey is a learning journey, the Institute is helping healthcare organizations build the capability to create and sustain a culture of continuous improvement through education, coaching, and facilitation that inspires, prepares, and guides.
The faculty and sensei at the Virginia Mason Institute work really hard to partner with other organizations to understand how to help them transform their healthcare to become the quality leader, and really understand the journey from the perspective of the patient so that we can reduce waste and at every step of the way improve value for the patient. The faculty and sensei at Virginia Mason Institute have all been at Virginia Mason through this journey of change and understand from many different roles, whether it's a physician, a nurse, a pharmacist, what change means for an organization and what are those foundational elements that are so critical to moving an organization forward and understanding that patient journey.
Virginia Mason Institute's faculty and sensei are rigorously trained in the Virginia Mason Production System, a lean management program that empowers leaders, providers, and frontline staff to measurably improve care every day. Today, the Institute's experts travel worldwide to help healthcare leaders create and embed a sustainable lean culture in their own organizations.
People were early on very interested in our journey and our Virginia Mason Production System work. And as our hallways became increasingly crowded with people coming to visit, we said, we can do better and we can create a curriculum, we can create programs where we can, in a very planful, systematic fashion, help organizations around the United States and around the world. One aspect of our vision is to transform healthcare. And through what that really means is to help transform healthcare with others around the world. And what we're able to do with our Virginia Mason Institute is build relationships, build opportunities to really share ideas and help all of us continue to keep getting better every day on behalf of our patients and our communities.
With a focus on eliminating waste and measuring performance, Virginia Mason Institute's expert faculty members train healthcare leaders on how to implement and sustain their work to improve the patient experience.
At Virginia Mason Institute, we have expertise in understanding how people learn. How better can you learn than to be in a classroom, understanding some of the concepts that we're trying to teach? We find it very important that you experience the concept through an exercise. You transform your role into a different person in your organization and understand how to reduce waste by playing a game, or how to understand the work of a frontline worker through role play. We use a lot of innovation. We have masters of innovation in our organization who really have taught us that if we expand our thinking around certain concepts, bring it into an exercise, that you can bring it back home to your organization and roll it out to your frontline team members.
Virginia Mason Institute plans to continue to support any and all executives and their teams in wanting to learn a new way of delivering healthcare. And our commitment is to reach out to those and expand and deliver. I believe that many more healthcare executives will see the value of this approach to improve patient care and reduce the cost of delivery as we see the results replicated throughout the world, actually, as we work with other organizations. The best part of my job is every day watching staff, managers, executives see the possibilities of really delivering on perfect patient care at a lower cost.
The perfect patient experience is possible. Virginia Mason Institute teaches healthcare leaders around the world to put the patient first and provide zero-defect healthcare every day. Learn more today about the Virginia Mason Institute, leading the world in lean healthcare. For more information, go to virginiamasoninstitute.org.